Today we will discuss the next cystode that affects the hepatobiliary system, that is Echinococcus, and we will see hydatid cyst in detail. We will see three cystodes today. The first is Echinococcus granulosus, in which we will see its morphology, life cycle, details of hydatid cyst and its diagnosis and treatment. The second is Echinana and the third is D latum. Again, just to recall as to which class of parasites we are dealing with, this is just a revision of the classification of parasites. Remember, we are still dealing with the tapeworms, that is the cystodes. From next lecture onwards, you will be learning about the roundworms, that is the nematodes. If you can recall from the last lecture, as I have already told you, the cystodes, based on the habitat, they are divided into intestinal cystodes and somatic cystodes. We already discussed the Taenia solium and Taenia saginata, and today we will be discussing Echinococcus granulosus, that is the somatic cystode, and we will see Diphyllobothrium latum and Hymenolepsis nana in short. Human echinococcus is a zoonotic disease, and there are four forms of human echinococcus. The first is cystic echinococcus, which is caused by Echinococcus granulosus, and the other three forms of echinococcus are alveolar echinococcus, polycystic hydatid disease and unicystic hydatid disease. These three forms are caused by different species of Echinococcus. Now we shall see the morphology of Echinococcus granulosus in brief. Echinococcus granulosus is also called as dog tapeworm because the adult worm, it resides in the dog's intestine. It is also called as hydatid worm. Now Echinococcus, it requires two hosts for its life cycle, dog and sheep. The dog is the definitive host and sheep is the intermediate host. Human beings only act as an accidental intermediate host. As I earlier mentioned, Echinococcus granulosus causes hydatid disease. The word hydatid means a drop of water, that is something that has been filled with some fluid, and this is called as a cyst. Echinococcus granulosus is worldwide in distribution and is especially seen in sheep raising countries. While in India, hydatid disease has been reported from various states like Andhra Pradesh, Tamil Nadu, Maharashtra, West Bengal and Chandigarh. Just like the other helminths, there are three morphological forms of Echinococcus granulosus: the adult form, the egg form and the larval form. The adult form measures around 3 to 8 mm in length. Remember, in contrast to the Taenia, which was in meters, the length of Taenia adult worm was in meters, while the length of Echinococcus is only 3 to 8 mm. The adult worm of Echinococcus has also got three parts: the head, neck and the body. The head, that is the scolex, it has got 4 suckers and 2 rows of hooklets. Then it has got a neck and the strobila, that is the body. In contrast to the Taenia, the body of Echinococcus has got only 3 proglottids. If you remember, there were around 1000 segments or more than 1000 segments in Taenia, while in Echinococcus there are only 3 proglottids or 3 segments. The first is immature segment, the second is mature segment, and the third is the gravid segment. Next is the egg form. The eggs of Echinococcus granulosus, they are morphologically very similar to the eggs of Taenia. As you can see here, it consists of an embryo with 6 hooklets surrounded by embryophore. And the larval form of Echinococcus granulosus is called as hydatid cyst. Echinococcus granulosus passes its life cycle through 2 hosts, that is the dog and the sheep. The dog is the definitive host wherein we can see the adult form, and the sheep is the intermediate host wherein we can see the cyst. The dog acquire infection by consumption of contaminated organs of sheep. The organs of the sheep are contaminated with the hydatid cyst, that is the larval form. Then these organs might get ingested by the dog. The larval form then develops into the adult form and fertilize and lays eggs. The eggs that are released in the environment are then ingested by the sheep. The eggs, once ingested by the sheep, they penetrate the intestinal wall, enters the circulation, and the eggs lays in different organs of the sheep, wherein they mature into larva, that is the hydatid cyst. And then this contaminated organs, when ingested by dog, the life cycle continues. As you can see here, the definitive host, that is the dog, the adult form in the small intestine of the dog undergoes self-fertilization and releases eggs in the feces. These eggs comes to the environment and are then consumed by sheep. These eggs then penetrate the wall, enters into different organs of the sheep and forms hydatid cyst, that is the larval form. When these contaminated organs of the sheep are consumed by dog, the larval form develops into adult and the cycle continues. Now man could be an intermediate accidental host. We shall see how. Man might acquire the infection by the ingestion of food that has been contaminated by dog's feces, which contains the eggs of Echinococcus granulosus. Once these eggs enters in the GI tract, they penetrate the intestinal wall, enters the portal circulation, and they are carried to liver. Most of them are carried to the liver. They might also enter to the other organs like lungs. Though majority of these embryo, they are all destroyed by the host immune response, but few of them escape and then they develop into a fluid filled structure that are called as hydatid cysts. Now these hydatid cysts might undergo maturation and increase in size at a rate of 1 centimeter per month. Now this stage is infective to the dog, as we have already seen that the infective form for the dog is the hydatid cyst. This stage of hydatid cyst in human might be infective to dog, but as the dogs, they do not feed on human viscera, the cycle stops here and man becomes the dead end, and hence man is an intermediate accidental host. Mode of infection in men, as I have already mentioned, might be because of injection of the eggs through hand to mouth route, that is while playing with the dogs. From the fur of the dogs, the eggs might get ingested and contaminated food or drink with the feces of infected dogs. The same thing has been shown here. The eggs, when ingested by humans through ingestion of food contaminated with E. granulosus eggs, these eggs enters the intestine, and from that the liberated embryo will penetrate the mucosa and carried by blood stream to various sites, the most common site being the liver, and the Other sites where they form hydatid cyst are kidney, bones and lungs, and also brain. Let us have a look at the morphology of hydatid cyst. Hydatid cyst is a fluid-filled bladder-like cyst, unilocular and subspherical in shape. The size of hydatid cyst can measure from few millimeter to more than 30 centimeters also. The cyst wall has got 3 layers. The outer layer is called as pericyst, which is derived from the host. The middle layer is called as ectocyst, also known as laminated membrane, and the innermost layer is endocyst or the germinal membrane. The ectocyst and endocyst are derived from parasite. The innermost layer, that is the germinal membrane or the endocyst, they give rise to brood capsules, and there are many number of protoscolices present inside the brood capsules. Some of these brood capsules and the protoscolices, they can break off and they get deposited to the bottom of the hydatid cyst and form hydatid sand. While all these brood capsules are surrounded by hydatid fluid. This fluid is clear, it is pale yellow in color, and a very important point of this fluid is that it is highly antigenic. It is toxic and it is anaphylactic. This cyst might have got two fates. The first is that it might undergo spontaneous resolution, and the second is the cyst might rupture, which may lead to either formation of secondary cyst, which is then carried to other organs, or there could be an anaphylactic reaction because of the highly antigenic hydatid fluid. Pathogenesis and clinical picture. The clinical manifestations of Echinococcus depends upon the site of the hydatid cyst, and the most common site being the liver. 66% of the hydatid cysts are in liver. In the initial few years, the hydatid cyst may grow up to 5 to 10 centimeter in size, and then this cyst may survive for years and decades without any symptoms. Then after many years, there could be some symptoms from the pressure effect of these enlarging cysts, like palpable abdominal mass, hepatomegaly, abdominal tenderness, etc. This cyst might then also obstruct the biliary tract and might cause obstructive jaundice. Or this cyst might then rupture, forming secondary new cyst and allergic manifestation because of the hydatid fluid. About 22% of the cysts are seen in lung, that is the pulmonary cyst, and the patient presents with hemoptysis, thoracic pain and shortness of breath. This is when the cyst is present inside the lung tissue. When this cyst transforms into a chronic pulmonary abscess, the patient might present with complaints of sudden attack of cough with sputum containing blood, mucus and hydatid material. About 1% of the hydatid cysts are seen in the brain, and the patient presents with complaints of headache. And 3% are renal cysts with complaints of hematuria and intermittent pain. This is a picture of hydatid cyst. Remember that the outcome of hydatid disease depends upon the size of the cyst and its location. As you can see here, many fluid-filled hydatid cysts. These are after the surgical removal. For diagnosis of hydatid cyst, imaging techniques play an important role, like X-ray, CT scan and USG. but also hydatid fluid microscopy can be done, but after the surgical removal. Once the cysts are removed surgically, the hydatid fluid can be aspirated and examined by direct microscopy, or it could be stained with acid fast stain to see the presence of hydatid cells. Diagnostic aspiration is usually not recommended because the fluid might then leak and cause anaphylaxis. Ultrasound is the imaging method of choice, and WHO has classified the USG images of cyst into 6 types according to its activity: CL and CE1 to CE5. There are typical appearances name given for few of them, like snowflake sign, honeycomb appearance, water lily sign, etc. There is a hypersensitivity test available for the diagnosis of hydatid cyst, that is called as Cassoni's test. In Cassoni's test, Cassoni's antigen is used, and this Cassoni antigen is basically the filtered hydatid fluid. In this test, 0.2 ml of the antigen is injected intradermally on the forearm, and a positive test is indicated by a wheal appearance with multiple projection. This wheal develops within half an hour and it fades away in 1 hour. But this might give false positive result in 18%, and also it might give allergic reactions. This test is not that used now. There are serological tests available for the detection of antibodies and antigen, like ELISA and hemagglutination assay, and molecular diagnosis is also available for the diagnosis of hydatid cyst. For the treatment of hydatid cyst, surgery is the definitive method of treatment, but there is an alternative method recommended, that is called as the PAIR technique, PAIR, wherein the P stands for percutaneous puncture of the cyst, A aspiration of the cyst fluid, then I is injection, that is ejection of the scolicidal agents like hypertonic saline, cetrimide or ethanol, and then finally re-aspiration of the fluid after 5 minutes, and this entire procedure is done under sonographic guidance. Also, anti-parasitic agents like albendazole and praziquantel can be given to prevent reoccurrence. Next cystode is Hymenolepsis nana. The adult form is quite similar to tinea, but it has got around only 200 segments, and the segment is broader. This is the egg of Hymenolepsis nana, which has got typical polar filaments. Hymenolepsis nana is also called as dwarf tapeworm. In the life cycle of H. nana, man is the only host and eggs are the infective form. Man might acquire the infection via ingestion of the contaminated food, or they might acquire infection by autoinfection. These eggs then develop into the adult form. The adult worms then fertilize and releases eggs in the feces. The eggs might then again contaminate the food, which is then ingested by the man or by autoinfection, and hence the cycle continues. This is the direct cycle. Rarely there could be indirect cycle. In indirect cycle, these eggs that are released in the feces, these eggs are ingested by rat flea, and the eggs then transform into the larval form in the rat flea, and very rarely man might acquire infection by accidental ingestion of this rat flea that contains the larval form, which then subsequently develop into the adult worm, and the cycle continues. Mostly the patients are asymptomatic, but there could be mild symptoms of abdominal pain and diarrhea. For diagnosis, stool examination is done and typical eggs of H. nana can be seen. As you can see here, it has got 2 layers and polar filaments. Infection with D. latum can cause vitamin B12 deficiency, which might lead to development of megaloblastic anemia. Thank you. Also, kindly note that you would be having your part ending exam of GIT soon, so be prepared for it. The date will be declared soon. Thank you.